It's Worth It: How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto Willis. Welcome to Politics Done Right. My name is Egberto Willis, your host. Good morning, Houston. Good morning, Harris County. Good morning to the great state of Texas. Good morning to the United States of America. Good morning to the entire world receiving our signals via the magic of El Internet, created by we the people, owned now by the billionaires, but something that we indeed will take back. Folks, we have a big subject to cover today, and and also I would like, after when we talk about this subject, to hear your opinions, personal, not only personal of whatever you can say, but positive or negative, because this is real, the subject that we're going to cover. And one of the important things that I want to make sure to let our audience know is we're not here to sugarcoat or to take ideological positions on things that actually have a material effect on your life. We want your eyes wide open, irrespective of what the truth says. But before we get into that, I've got to pass it on to the great folks in El Estudio. That's Howard Reynolds, Jack Van Bibber, and Mayana. Buenos dias, mis personas favoritas. Good morning, my great favorite people. How are you guys doing this morning?
Good morning. We're doing good. We're doing good. Good to hear you.
Good morning, Egberto. How are you?
I am doing fine, my brother. Talk to me.
All right. Today's subject is Medicare take advantage of you for sure. All right. Yes, Medicare Advantage is a total scam implemented by the George W. Bush administration. The idea is to trick the consumer into believing they are getting something for free, when in reality you're buying an insurance policy that supersedes your Medicare Parts A and B. They'll claim you get free dental, free vision care, no co-pays, choose your doctor, and in some cases they'll say zero premium just to get you to sign up. Remember, people, nothing is free. Free is a is a carrot on a stick. They lead you in another direction that is more advantageous to the insurance company than the client patient. First, the IC, that's what I call insurance companies, ICs, that sign you up gets an $8,000 sign up bonus from the government. I don't know if that's yearly or just a one time thing. Can you answer that, Egberto?
They actually get about 8,000 or more per patient based on how they get coded. So they actually try to make you look sicker than you are to get even more than that every single year, my brother. It's called a capitalized expense.
Yeah, and how they do that is that with their questions. They ask you if you're depressed. They ask you if you have herpes or something like that, and then they include that in their billing for you. They're billing you for all your care, not just your care that you're receiving at the time. So that's part of the scam too. Then the Medicare Advantage take advantage of you, takes over the administration of your Medicare, and bills Medicare at a nice profit for your care. Everything goes fine with normal care, but when you get really sick with a costly disease that goes bad, and your care costs more than their profit margin allows, they will deny treatment, delay treatment till re-enrollment time, and drop you like a pancake on the floor. So, so,
Oh,
so this is just a fascist scam on the part of the government and the corporate-run insurance that will kill people rather than pay for their care.
thank you very much for that, my dear brother. Now, I here's the thing about it, right? We have a good friend of mine, a great supporter of mine, that calls in. He is an older guy. He's 90 something years old. I'm pretty sure he is going to call today again and talk about how he loves his Medicare Advantage. My brother, my 90-year-old plus brother, and that's what I call him all the time. When I see him, I give him a little hug, all that good stuff. He's a great guy. He eats well. He's always in shape. And he said, all you got to do to stay healthy is, and he'll give you the whole rundown of what you need to do to stay healthy. And the thing about it is, he has had nothing but good experiences with Medicare Advantage. Justifiably, he likes it. He pays absolutely nothing when he goes in to see the doctor. It works as, as it would work in good healthcare places like Taiwan, where you show your card and everything works perfectly. But it's not only him that has had great experiences with Medicare Advantage. Our beautiful Mayana in the studios, a relative of hers, is on Medicare Advantage and is having a great experience to this day. Mayana, why don't you tell me a little bit about that?
Yeah, my mom got really sick some years ago, and she has Medicare Advantage, and we really just don't have any complaints. She was in the hospital, and they didn't know what she had, and she was in hospital for about 4 months. The hospital itself took good care of us. I know that that's not itself Medicare Advantage, but
No,
the
no, no.
hospital took good care
I
of
want
us.
you to tell your story because I want to be very honest with people. There are
Mhm.
people on Medicare Advantage that have great experiences. Your mom
Yeah,
is one. So please tell me, finish telling
absolutely.
me.
I mean,
Yeah.
she could have, passed on a few times. Actually, she doesn't even remember half of what happened while she was there. Every time we tell her story or she sees what she looked like at that time, she is just amazed because everything was pretty much taken care of. Any specialists and things that she needed. And because of that, she's still here today. And as far as I know, she's still on Medicare Advantage. And I haven't heard her complain about it at all. So for us, it was a great, thing.
Look, Mayana, thank you very much for that testimony because what we have to do is we have to have all the testimonies. If we're going to be truthful about something, and what you're going to hear me say about Medicare Advantage, once we have other anecdotal folks that come in and say how great it was, we can't argue or discount those people's experiences at all. Your mother's experience with the coverage that she got was real and it occurred. And when you're trying to talk about something, especially in this type of a economic system, for it to work, you have to have testimonies from people, a good percentage of people, like you've just told us, Mayana. We must have a lot of your people like your mother who has had great experiences. We have to have people like my good friend and supporter who has had great experiences with Medicare Advantage. Those testimonies are necessary to be able to keep something that is not good for all of us alive. And that's the problem. The problem is Medicare Advantage work for a percentage but for all of us it doesn't. And that is the problem. Medicare, traditional Medicare, works for all of us because all the restrictions that would apply to Medicare Advantage, the ones that because of fate, Mayana's mother was able to be in a particular group that is doing just fine, is great. But if that group that Mayana's mother is in, the group whenever you have Medicare Advantage or anything with private healthcare, you are classified in a group, and that group has the metrics. The metrics that tells if that particular group is making money, if that particular group is spending more money than it's taken in from the government and from you, etc. And when that particular entity fails, then all of those folks in that group will likely close and move on to the next, and likely the next group will not have the same doctors, will not have the same medicines that they support, and in fact may have coverages on procedures that are different than the previous. Because remember, Medicare Advantage is private, and as being private, the sole purpose of a private company is not you, is to make profits for a shareholder. But let me go ahead now. I wrote an article late last night, and I titled the article, uh, Why Medicare Advantage Will Always Be a Disadvantage Compared to Traditional Medicare. And one of the other things is, this morning when I called in and Mayana had that good story, I asked her, I said, could you go ahead and tell your good story about your mother and Medicare? Because again, folks, we can only be real if we're real. There are people, many people, with great experiences with Medicare, some that are very sick and some that rarely ever use it. The problem is that reality fails a whole lot of people by design. So here we go. Medicare, the American healthcare system is infamously complex, profit driven, and inequitable. But perhaps the aspect better exemplify this broken system is Medicare Advantage. Despite slick advertising and aggressive marketing campaigns, the Medicare Advantage is a privatized model. Traditional Medicare isn't. Traditional Medicare is run by the government. Medicare Advantage is run by private companies. Private companies are there not for you. Always remember that. Every private company, the purpose of that company is to make a profit for its shareholders. That's not a bad thing. Making a profit for your shareholder is not a bad thing. The only problem is when it comes to healthcare. A profit motive should not determine whether you get care or not. A profit motive shouldn't determine whether you live or die. But if a profit motive determines what is giving you care, that means it directly it determines whether you will live or die. And if today it is okay, today it is perfect for Mayana's mother, today it is perfect for my friend who has Medicare Advantage. But it was imperfect for Tom Hartman's buddy who had an aggressive prostate cancer. And he was set up to go to the Mayo Clinic and went out to the Mayo Clinic just to find out as he got there that that particular group that he was in, that particular group in Medicare Advantage that he had, that was not taken or covered by the Mayo Clinic. And as such, he had to go to the substandard folks that would care for his cancer, one that ultimately caused his death. Tom Hartman wrote a book. It's called The Hidden History of American Healthcare: Why Sickness Bankrupts You and Makes Others Insanely Rich. That, I believe, that book, I interviewed Brother Hartman on that book several times. That is an essential read. Again, I don't want those of you that are on Medicare Advantage with good stories like Mayana and Jimmy and other good friends to think that, well, what I am saying can't be real because look at how good we are having it. Because one of the things that as someone who has this platform, as someone who's honored to have the airwaves has to do, is not work or support some people, but in fact, all people. And if all people are not going to have the proper experience, the access to living that, again, that should be afforded all of us. If it's a crapshoot, whether you choose the right plan, live or die, and we just leave it that way, I would not have been doing my job. As the political and corporate push for Medicare Advantage intensifies, it becomes all the most important to understand why this model is a fundamental disadvantage to patients and a dangerous grift, siphoning public dollars into private hands. You know, Mayana told the story of her mother having several illnesses. One of the advantages of her having several illnesses is that she can be marked up, and I'm going to talk about that in a little bit. Medicare Advantage is a Trojan horse for privatization. Medicare Advantage plans are sold by private insurance companies, which means for profit companies, but funded largely by taxpayers. So it's a transfer of money from us to the companies, right? In other words, we let me go in a little quick backstory before I continue here. There was a time in America, and this is what Johnson spoke about. There was a time in America where old people getting up there in age, didn't get health insurance. They couldn't get health insurance because it was too high. You see, it's a for profit business. Health in America is a for profit business. And what happens is when you're young, you rarely go to the hospital, you rarely go to the doctor, you're happy, you're partying, you're doing your stuff. So you're paying your health insurance premiums, but you never use the damn thing. As you start to get older, you start to use more and more healthcare. And what these guys figure out is, well, when you pass 65 years old, you use a hell of a lot of insurance. So we just either make the price of that healthcare very high to cover that a lot of people at an older age get sick, or we just drop it altogether. And that's what private insurance companies did. And Johnson started with Johnson, said, we have to do something about our elderly care that are getting poor, that are getting sick with no support. So they created Medicare, they created Medicaid, and these other programs that you paid for. Every American citizen, Medicare is not free. When you pay, and every time you get your check, and a lot of people want to call this an entitlement. This is not a damn entitlement. This is something you paid for. You worked hard all of your life, and you paid 3%. 3% of your check from the time you started working goes into the Medicare fund. 3% every year of every single worker in America goes into that Medicare fund, and you pay for it. And the idea is, since everybody is paying for it, by the time you reach 65, the government pays for your well-being. Okay? So while this capitalized payment system may sound efficient, the federal government pays insurers, right? A fixed per person cost. I'm talking to Medicare Advantage now. That's what Jack was talking to you about earlier. Jack says every year, every person that signs up for Medicare Advantage, not Medicare, that private company gets a fixed amount of money. It's called a capitated payment from the government to that company. So whether, as my good friend Jimmy, when he rarely goes to the doctor for anything serious. So even though he doesn't use a whole lot of the system, the government gives him way more than $8,000 to that private insurance company that's giving him Medicare Advantage. They pay him way more than $8,000 because I guarantee you, at my brother's 90-something years of age, they are going to tell the government all this crap is wrong with him. But I know him. He's very, very healthy. But they're going to get thousands of dollars every single year from my brother. That's a capitated payment. All right. Now, while the capitated payment system may sound efficient, in practice it incentivizes insurers to maximize profits by minimizing care. Insurers routinely deny or delay care using insurers routinely deny care using some internal algorithms, cost avoidance techniques, and prior authorization hurdles that are absent in traditional Medicare. The more they don't pay out for care, the more they keep as profit, often without delivering medical healthcare benefits at all. A 2022 report from the Office of the Inspector General found that 13% of prior authorizations denials in Massachusetts plans actually met Medicare rules, but were still denied by the plans. That 1 in 8 people denied care they should have received under law. This is not just an administration error, it's structural abuse. Let me pause there because this is where Mayanna's mother and my friend Jimmy, who has great health care, come into the fold. And Jimmy is here. I can see Jimmy waiting on the line. And I'm going to pause my commentary. I'm going to stay with this soliloquy, but I want to get Jimmy's experience. And I'm assuming this is the right Jimmy. Come on in, Jimmy. Uh, Jimmy, you're my brother that have a
Hi,
great
Bertram.
experience. Yeah, you're my brother with good experience with Medicare Advantage, right?
Yeah, I'm your 91-year-old friend who loves my Medicare Advantage. I have no copay. I see my doctor, and he gives me a lot of good advice. The other day, I told him I was walking with my cane occasionally, and he said, I think you should use a cane all the time because if you fall and break your hip, you'll be sorry you weren't using your cane. So now I use my cane all the time. And another thing, I heard about this RSV vaccine, and I went to Walgreens, and they said the company would not pay for it, United Healthcare, and they wanted $200 for the shot. So I decided, well, I'll wait and I'll check with United Healthcare. So we called United Healthcare and told them about this, and they said, oh, it's covered under Part B, not Part D, something like that. And so we went back to Walgreens and got the shot, for free. So everything's good with my Medicare Advantage, and the company is United Healthcare. If they're getting $8,000 a year, I would think the accountants should check that out, see how much profit these companies are making. If they're making a big profit, we'll cut that down to $6,000 or whatever to make it more equitable.
No, well, actually, the thing about it, Jimmy, is look, when in a for-profit system, right? It is, if they, the amount of healthcare that you don't use, right, is some of the healthcare Mayanna's mother uses. So that's how private insurance is supposed to work. Everybody shouldn't maximize how much they get because the extra that they don't have to use on you and other healthy people is actually supposed to cover the extra health care that Mayanna's mother uses, which is likely more than the $8,000. But that inherently is the flaw, right? Because if in one particular group they don't have enough Jimmys and they have too many Mayanna's mother, that system goes away. You see what I'm saying? That
Yeah,
system,
I understand that. There'll be more people who need a lot more health care than I do, for
right?
example. And they should get it, and they should not be denying health care to anybody who has a legitimate claim.
Exactly, and let me explain something as far as what you just said, and I needed you to go ahead and I wanted to hear your good story and Mayanna's good story to put it into perspective. Um, right now, the way insurance companies make profit is something that they call they they do risk analysis, right? So every single group has a risk analysis on it. So they try to create all these groups that have a certain amount of sick people, a certain amount of a certain amount of. Before I continue, I need to. Do you lie is out there saying I'm deceiving people. Do you lie if you think I am deceiving people? You call in and you tell specifically what is it that I'm deceiving people about? Do not go into a comment section and challenge what I am saying, my dear brother. Call in and make your case, my dear sir. Because do not we want people to be informed. One of the reasons I wanted to hear Mayana's mother's story and Jimmy's, which seems completely different than what I'm talking about, Medicare Advantage, is to show people I am not trying to hide the realities, but speak about what's happening in the country. So if you think there is something wrong with what I'm saying, call in and defend specific points that you think I am saying incorrectly, sir. Now continue.
One more thing.
Yes, sir.
Yeah, I have friends who are just on regular Medicare, and they are paying monthly fees. I don't know, several $100s. And
Yes.
I'm wondering why they don't switch over to Medicare Advantage, because I pay nothing, and I get all this Medicare for free.
Let me explain why.
Why
let me
don't switch over?
That's a very good point, sir. You don't have to pay a penny at all for your Medicare Advantage at all. But when I turn 65, I will be going with traditional Medicare, and I will be paying likely about $200 something a month for the supplemental plus Part D. And I'm going to explain that. I'll explain why when I turn 65 I'll do that. But thank you, Jimmy. Anything else you want to say before I continue?
Yeah. Please explain to us why you would be willing to pay several $100s a month when you can get Medicare Advantage for free.
Yeah, I will say that. I will say that. I will explain all of that as soon as we hear. So thank you so kindly, Jimmy, for calling and telling us your story, sir.
Thank you, and this is a great discussion today. I hope everybody learned something from it.
Thank you, sir. All right. Jimmy just said something so important, and it's why it is so difficult for us to make this point as do not privatize Medicare at all, because Jimmy is right. The very enticing thing about getting your health care in your older as you get older and not have to worry about the plans that I talk about doesn't involve copay. Let me first tell you about my friend that we went to coffee yesterday, and we were talking about how are we going to get this message out. He had prostate cancer. He also has multiple sclerosis, and his drug costs, again, the drug companies are ripoffs, of course. His drug costs $120 something thousand a year. And he has traditional Medicare, and they pay the bill. He also has the Medigap, which used to cost him $120. With all the price rises, it now costs him $250 or somewhere around there per month. And you may ask, why, if Jimmy can get Medicare Advantage where he pays nothing, and instead you decide that you want to pay $250, and again, everybody doesn't have it. So I understand that the way the system is working right now, some people, the only choice they have is to go for Medicare Advantage. That's how screwed up our system is for something that we've all paid for. Now, the issue is the following. Had my friend not had traditional Medicare, and the cancer doctor that he went to likely would not have taken all the different Medicare Advantage plans, had he not maybe he would have lucked out and chose the right group, but had he not chosen the right group, that person would not have been in his plan. And there's a good likelihood that the outcome that he's had for cancer and the outcome that he's had for multiple sclerosis would have been much worse. It is about one's life. It's about what happens. Note that I previously said 13%, 13% of all requirements. Again, this is a study in Massachusetts only, and it's probably worse in many other areas of the country. 13% of procedures and medicines that were requested were denied. And 13% may be like, well, that's not the majority. That's not even close to the majority. But those are millions of people who, as a crapshoot, were said, we're not going to give you that radiation treatment. We're not going to give you that cancer drug. We're not going to give you that issue. What is that worth to you? And Jimmy has a good plan. Jimmy is in a big healthcare city, Houston, Texas, where we have the medical center, where there are many options, usually more. But folks in rural areas where they either don't have a hospital or where they don't have many choices, that's just where they are. They don't have many choices. Look, I'm going to go into a few more of the narratives and then I'm going to continue. But traditional Medicare operates with an overhead of about 2%. And these are kind of numbers. Now, sometimes people just gloss over these. Again, Medicare, to administer traditional Medicare, it only costs 2%. So let's say Medicare takes in $100 billion. Right now, it is close to 50-50. 50% of people are on Medicare Advantage, a little over 50%. I think it may be 43, 47. And let's say 47% of people are on traditional Medicare. Are on traditional Medicare, while a little bit over 50 are on Medicare Advantage. What you find is that the people that are on Medicare Advantage, that it only costs 2% to administer those plans. But for the private sector, it costs them 15% to administer that plan. And where does that money go? So let's say each of them have about $100 billion. That's 15 billion. I'm just using hypothesizing numbers now. $15 billion in the private sector goes straight into the pockets of shareholders, goes straight into the pockets of the people who are selling you or convincing you that Medicare Advantage is a better option. While only $2 billion, $15 billion versus $2 billion, it goes for traditional Medicare, in supporting traditional Medicare. I want you guys to understand, they are trying, when they talk about privatizing healthcare with Medicare Advantage, they're trying to make you believe that math doesn't matter. If in private healthcare, they have to pay advertising, they have to pay shareholders, they have to pay for all these other expenses that traditional Medicare does not have. It is impossible. This is a mathematical impossibility for Medicare Advantage to be more efficient than traditional Medicare. The math just doesn't make any sense. There are people skimming money to pay the people who sell it, to pay the people who are sitting at their pools that invest in these companies. It is important that that math prevails here. And it's something that is unsustainable. So how does a private sector do it? There are these things called upcoding. Remember Mayama's mother, she said she had a whole lot of different illnesses. Well, that gives them the ability, as soon as she comes in, to do what's called upcoding. So they will make her seem even sicker than she is, because the sicker one is, the more money they get per sick person for that person. So her mother will get that much more into, provide that much more into Medicare. So we want a certain amount of people that we can upcode. Jimmy, who is 90 something years old, the mere fact that he's 90 something years old, I can guarantee you, and you notice how he talks about the people talk well to him, give him what he needs. He is upcoded. What that means is, I said, $8,000. He gets a lot more than $8,000 for Jimmy because he's 91 years old, even though Jimmy is healthy as an ox. It is so important for us to get that. The narrow networks, the other big thing, the narrow networks. Mayana has a great network Perrin has a great network that they're in right now. They separate these guys into things called groups. If that particular group starts to lose money, she will have to be migrated into some other group. That other group invariably will not have necessarily the same doctors. That other group invariably will likely have more restrictions on what they are going to cover, what diseases they will cover, what medicines they will cover. And that is what's to be expected. This isn't something that I am inventing. Anybody will eventually find out. And that's why when you research Medicare Advantage, how many people are on these plans that simply hate it. The problem is there are too many Jimmys and there are too many Mayana's mothers who have a great testimony to give. And their testimonies are real, that they've had good care. It's not the Medicare Advantage insurance companies giving them good care. It is a medical system of doctors that are giving them good care. But the payment methodology is where it fails. Let me tell you one of the biggest problems here, because remember the last time we spoke to Jimmy said, Egberto, tell me why the hell I would pay $120 a month or $250 a month if I am getting it for free right now. And free is always good, right? I can put away, I don't have to pay that out. Let me tell you why. When you have traditional Medicare, that $250 is for that thing I said called Medigap, which covers the 20% traditional Medicare doesn't pay. So remember that. Medicare Advantage, traditional Medicare is an 80-20 deal. The government pays 80% no matter what, and you pay 20% no matter what. And that can get prohibitive. That can get expensive if you have to pay for that out of pocket. So in effect, the government, in its terrible wisdom, have decided not to cover your Medicare by 100%. So you have to go get to keep the private sector involved. Long time ago, they went ahead and created this stuff called Medigap. So Medigap is a private sector insurance that pays for the 20% traditional Medicare doesn't pay for. And that is where you get that $120 to $200 that we speak about, that Jimmy says, hey, why do I want to pay that? And let me tell you why. When you turn 65, and this for folks of you near 65, this is the most important portion you are going to get from this discussion. So please listen well. The 20% that Medicare doesn't pay, you need a Medigap plan to cover. That way, you don't get those heavy charges. You pay zero. You just pay that monthly, and you never pay anything out of pocket. The reason is the following. Whenever you get at 65 and 6 months thereafter, you have the option to get Medigap without them having to check whether you're sick, without them having to throw you through the actuarial tables, without them looking at any pre-existing conditions or anything. So if you turn 65, get traditional Medicare and get your Medigap, Medigap, you're done. You're done for life. You will just pay whatever Medigap charges, nada más, and that's it. Whenever you get sick, you go ahead and go to whichever doctor you want, not what the enslaver tells you you can go to. Remember, Medicare Advantage tells you what doctor you can see, what hospitals you can go to, and what medicines you are allowed to take. That's Medicare Advantage. The corporation tells you all that you want to do. It's that form of antiseptic slavery that I've always spoken to you guys about. But on traditional Medicare, you go to whichever doctor you want to go to. You go to whatever hospital you want to go to. You take whatever drugs that doctor says you need for that particular thing. Now, here is the deal. Here is the deal. Let's say you take Medicare Advantage, and what you run up against, what I said, is going to happen ultimately to everybody who is on Medicare Advantage long enough, that you get some sort of an illness and they tell you, no, you will not be covered for that, or no, you can't go to that hospital, or no, you can't go to that doctor that is the appropriate doctor for that disease. And you say, well, you know what? If I was on traditional Medicare, I could. So I am going to go to traditional Medicare. Everybody that's on Medicare Advantage, they can go back to traditional Medicare if they want to. But there's a catch. That part that you have to pay for, that 20% that those who decided to go with traditional Medicare is paying for every month, the one that Jimmy talks about, why would you pay that? When you try to go back to get that Medicare Medigap program, at that point you go through what's called the actuarial tables. In other words, they are going to run you through a qualification process to see if you have pre-existing conditions, to determine if how much you're going to pay for that Medigap program, or if you're going to be able to get it at all. And that is the point where they get you. That is how they hold you on to Medicare Advantage. Because if you go there because you're sick, you will not be able to get that policy for that 20%. And then at that point, they will deny you. So let me tell you, just like Jimmy had his story, let me give you John A's story. He says, my mother-in-law needed to go to short-term rehab for a broken hip. The facility said they would not have been able to take her if she had been on Medicare Advantage. And that's the sort of stuff I'm talking about. Sandra said, just be in a hospital waiting you and listen for those turned away for the scheduled procedures on Medicare Advantage. But my husband was covered. These are stories that you hear all of the times. If anyone gets any serious medical issue, you will be very glad if you have traditional Medicare. John A. So it's never happened in Israel. Free healthcare, America sends them billions. We need to keep that money and have free healthcare in America. We need Medicare for all. Absolutely so. So, folks, I didn't get to salute everybody because I know the subject was going to take me a lot of time, but thank you all for being here. Jacqueline Camfisi, thank you for here. Jacqueline, it's just like Car Shield. You're absolutely right. Harry Denson, welcome. Eric, welcome. Margaret Ryan, all of you, thank you so kindly for being here. Joe from California, Lisa Blair from Atlanta. So, folks, there's a lot more that I need to cover on this, and I'm going to be covering this, the fraud that Medicare Advantage constantly do. They've been in 2023, the Medicare program was overbilled by more than $75 billion via Advantage plans. That's your money. All of us that are paying that 3% every year, that's our money going into the pocket of wealthy shareholders. So this is just a public hijacking of our healthcare system. Now, before I jump to the telephone lines, I want to tell you this. The solution is simple. Medicare insurance companies do what's called risk analysis. We should not allow risk analysis. We should have one risk analysis, and that is the healthcare of the country. and there is enough money by collecting 3% of everybody's salary, which we do right now. If we got rid of Medicare Advantage completely, listen to what I'm saying. If we got rid of Medicare Advantage completely, there is enough money collected with that 3% and with some other incentives to drug companies, etc., that would allow Medicare to cover absolutely everybody without the need for Medigap. Absolutely everybody without the need for Medigap at 100%, and give people dental dental, hearing, and eyes. But again, when you have a government run by corporations, this is what happens. There's a lot more to discuss on Medicare, but I wanted this discussion. First of all, I wanted to hear those with good testimonies, because for all of you out there, I want you to know I am not trying to tell you that, oh, it's always doom. And then you sit back there and have friends who have, things working right, and say, you see, Egberto, and all those people talking against Medicare Advantage, you're full of crap. No, folks, understand that in order for these systems to work, you have to have a large percentage of people giving good testimonies, having good experiences. It is imperative. But where they make the killing is on the bad experiences. When all those experiences, all those things they deny, that is denial of care for profit. And we'll continue talking about this subject because it's important. We need to kill Medicare Advantage, and we need to have Medicare for all, so that everybody's experience actually turns out to be the experience of Mayena's mother and the experience of also Jimmy. That experience needs to be universal. And we collect enough money to make that experience universal, instead of being manipulated by corporations who populate the pockets of the wealthy with your tax dollars. Let's go to John, line 1. Thanks, Star, for having you wait in, John, but I needed to get this stuff out whole. And notice a person my brother complaining on air wouldn't call in, so that we could have decide and have a civil conversation of how this stuff really works. Thank you, my brother John. Come on in.
Yeah, I have experience from having Medicare and a supplemental or Medigap policy, and also a health policy. And to Jimmy, well, that's great, but you don't get insurance. You insure yourself for the possibility of some of these diseases that you might survive with good treatment that you're not going to get in Medicare Advantage if they deny the treatment. And we spend more in this country than in any other Western industrialized country in the world. And these are facts. You can look them up. And what do we get? We get a good portion of the population are not insured at all. We get this kind of care, and we make insurance companies wealthy. And I'm sorry, what right do they have? I worked in healthcare. What right do they don't do anything to cure people. Just think about it. That money that they're taking, from grandma could be used for grandma, but no, it's being taken from her and him and everybody else to make a profit. We're a commodity to them.
Exactly.
And, goals of healthcare and the goals of healing people clash inevitably. That's why in other countries they take it out of, the capitalist mode, and they put it in, for everyone as a human service. It's a service. Like, why? Why would you do that to people? It just wouldn't fly, no matter whether you were a right winger or a lefty.
If I can add to that, John, In fact, even the most conservative politician in Great Britain or in Canada, you won't hear them talking. In the
Yep.
case of the Great Britain, the National Health Service. In the case of Canada, Medicare for all, they won't touch it because they know what it was like before. And we as Americans, remember the subjects that I talked about: rugged individualism, suffering in silence. All of
Yep.
those issues are the
Yep.
reason that they are able to con us the way they con us now.
Yep. And, Tommy Douglas, who started the Canadian system, he is the most revered person in Canadian history, on
Yes.
left, right, middle, ever, and I live here on a border state, and I've worked in hospitals. I've never touched one person who came from Canada and said, oh, the healthcare is just so horrible there, and I'm here to get better health care. It's five
Hey, John,
hours down the road
John, I
here.
got to let you go because I got some other calls, but let me just say this, John. You nailed all those major issues, and it's important. We were indoctrinated up front that somehow the private sector is more efficient. All these were lies we've been told, and it's hard to get this out of
Lies.
one's psyche after you've been indoctrinated
Yep.
from birth into that model. But thank you so kindly, my brother. I got to go to Augie. Thank you, John. Augie, come on in, sir. Oh, we lost Augie. All right, Brian, come on in.
Yes, good morning. I hope everyone had a good weekend. Countries don't invest in the United States companies. I don't know where you got your information from, but that's totally incorrect. Inventec has proposed an $85 million works. Novartis is $28 billion. Roche is $50 billion. Is $55 billion. SoftBank is $100 billion. The list goes on and on. Taiwan Service Corporation, $165 billion. Now, those are private companies, not countries investing in the United States works in development, in research, and production facilities. Where do you get the idea that countries cannot invest $12 trillion? Where did you get your information?
Are you done?
Yeah, I'm done.
Okay, so let me answer you first of all. The state and countries invest is a metaphor for those companies within the countries invest. Now, one of the things that I said is, why would they invest in America and not their country? And that statement that I made stand, and you can look at the amount invested in one's country and the ones invested outside one's country. That's not a hard figure for you to decide to go look up. If you want to, there's something as simple as ChatGPT to find it. Now, all the investments that you mentioned about these companies investing here, there's one thing that you can also look up on ChatGPT. How many companies have said, in order to placate somebody as somebody that is easily placated like our president, that they're going to do something to give him bragging rights and never did something? Remember all the investments that were going to occur in Ohio, where your president told the people not to leave Ohio because this investment would be made, and they were not made. This is a constancy with this administration, where they tout all this investment that is going to be placed there, and these investments are never ever realized. There's no contract that says they must spend those particular $1 billion that they've convinced your great Führer that is going to be made. So what I'm
Don't call
saying
him the
is,
Führer, man.
well,
Man, don't call him the Führer,
did I
okay?
interrupt? Did I interrupt
He's
here?
not Hitler.
I did. It's actually worse in many cases, and I'll explain that in some other time. Because what Hitler did to one sect of people, this man is actually doing to an entire a large portion of the country, including yourself. Unfortunately, you haven't yet realized that, my dear brother. But the damage that he is doing right now is a systemic damage to the entire country, provably so. All right. Anything else before I gotta go, my brother? Oh, you're left already. Okay. Anyway, folks, we've got about, let's see, 2.5 minutes. So let me throw it back to the studio before I close up my thing on Medicare Advantage and what the Texas folks have done. Go ahead, Mayana, Jack, Howard.
Hey, we're here. I'm just listening, and I'm just kind of thinking that I'm looking to hear a little bit more on this
Hmm.
because I'm still kind of just trying to get a grasp of it, like the upcoding and the groups and the Medigap, and I don't know.
Hmm.
I'd like to like even hear some other testimonies of people who didn't have you know
A
a
good,
good experience
good experience.
because I'd like to know why and how that happened and what was the deal with that because I'd like to hear the other side of that.
And that is so important, man. And that's one of the reasons I wanted to hear your mother's story again, is to let people know that no, they're good stories and we have to be truthful, because if we're not truthful all around, again, you lose your credibility. But anyway, thank you, Mayana, for that story. I needed that for the program as well. So thank you. And anything, Jack?
Yeah, I wrote down, there are people out there that want to extract the money from the old people that the old people have accumulated before they die. That's what
Hmm.
they're after.
Oh
They're
yeah,
nest eggs before they
that
die.
exact. We are no our economic system is known as an extractive system. It's a very extractive system. Uh, we have to realize that, and I'll continue to talk about this because, again, remember, our ultimate goal as a community station, a public station, is to inform in a manner, and again, to be truthful. All those that think they disagree with me, I entertain you calling in and making your point. It's important. It is very important. But anyway, folks, let me just say that we're getting out of here. I want to give a big kudos to our Texas Democratic legislators who left the state. And as they left the state, they to prevent the redistricting. I don't know how long they're going to be able to be gone, but let's make sure to support those who are supporting us. Let's make sure to learn. Anyway, I got to get out of here. Please get the rest of the program at politicsandright.com/newsletter, politicsandright.com/newsletter. Likewise, you can reach me directly at kpft@politicsandright.com. And also, for those who disagree with me or are shy to get on the phone, please write me. I will talk to you. Hell, if you disagree with me bad enough, I'll call you on the damn phone and we can have a civil discussion, because this is how serious this thing is. My name is Love you all, first of all of you. My name is Egberto Willis. This is Politics Done Right, and you guys know how I end this baby. I am what? Out.